If you've been injured in an auto accident in the state of Florida, here are the three first steps you need to do. First, you have to report that injury to a medical provider within 14 days of the collision. On the 15th day, you'll lose all benefits. In the past, patients would go to emergency rooms to document those injuries, sit among sick people for hours, get exposed to unnecessary CAT scans, be discharged with medications that can be delivered to you through a telemedicine portal without ever leaving your home. A better process is telemedicine. At Florida Injury Centers, we offer telemedicine services. So you can report your accident at the crash scene if necessary. I can get reports out to the insurer. I can call in medications all without you leaving your home or returning to an emergency room. So the first step is reporting the injury. If it's not reported in 14 days, there is no injury, your case is closed. The second is to have somebody who has experience in documenting the injuries document the injuries. Often patients will go to their primary care physicians. Primary care physicians don't want anything to do with auto injuries. There's litigation involved often. They don't want to touch it. So they'll go somewhere else, to a center that doesn't have experience in medical injuries. And they'll do a report that's not favorable for your outcome. It will either lack important information about the crash or about your injuries, which may lead to you having less access to medical care. So you need to go to an experienced physician who has been treating auto-injured patients in the state of Florida for some time. So that is a second step. First, get it documented. Second, get documentation that's done by a professional who's going to help you support your injury case rather than lead to errors in reporting that can cause you issues long term. And the final urgent step is to get access to medication if you need it. Often patients will go into centers where there are no medical doctors available, and they're suffering in pain. And they may be told, well, just suffer, and with time it's going to get better. You don't have to suffer. We don't use opioids. Opioids are dangerous and addictive. But you should have access to medications like muscle relaxers, anti-inflammatories, neurologic agents that can reduce your pain on the front end. Obviously, physical rehab, physical therapy, chiropractic is going to allow you to fully recover. And that's the goal long term. But short term, you shouldn't be suffering. See a medical doctor who has experience in auto injury, and make sure you're on medication that will not only relieve your pain, but potentially reduce your risk from developing further and permanent disabilities. If you have any questions, give me a call, 866-402-4250. I'm Dr. Huffman from Florida Injury Centers. We have locations throughout the state of Florida. You can reach me 24/7. That phone number, 866-402-4250, is my personal cell phone number. It's not picked up by a marketing person or an assistant. That's my personal cell phone number. If you have an injury, you want a free consultation, give me a call. There's no harm done by speaking to a medical doctor. If you need services, we can help. If you want services elsewhere, that's fine. But the consultation is free. Thank you.